the second one, Wernicke's. When you see Wernicke's area, that's our understanding, comprehension, right? It's associated with impaired language comprehensions. Patients do not have insight. What does that mean? They didn't even understand what we asked. So it's like you ask something, they will either look confused because they don't understand. But can they talk? Yes, they can. But the problem is they have to understand it in order to talk properly. Is that clear, folks? All right. Now, third one, conduction aphasia. This is very rare, where the wire is affected. That's like, arcuate fascicle affected. When that arcuate fascicle is affected, you have no problem in Wernicke's, no problem in Wernicke's. So what does that mean? You have no problem understanding, but you also have no problem talking, but information cannot be relayed. So you ask something, they will answer something else completely, but no connection between folks, okay? So that's for arcuate fasciculus. And the last one we call global, where you had an infarction or some stroke. Both Broca's and Wernicke's are affected, folks, okay? So that's one. Now, if you were to get a question, it will be in this, because this is the most common aphasia, Broca's aphasia, folks, expressive, folks, okay? That's the idea. All right.
When I was in school, they taught us that sometimes when people are bilingual, so they learn language, like more specifically later in life after their brain has already developed, when they have a stroke, they'll actually forget their primary language, but they're able to speak the second language. Does this tie in at any point or no?
No, that's somewhere beyond with the memory. Because
Okay.
here they forget the first language, but they talk the second language. It's a memory.
Okay.
Here, the problem is forming the word. That's a problem, right?
Got it.
So
okay.
that's
cool. Thank you.
But that's crazy, right? To forget one language and you remember the other language.
They'll learn a language after your brain develops.
Wow.
Can you repeat conduction again, please?
Conduction is a damage to arcuate fasciculus. So they understand, they can also talk, but it will not make any sense. You ask something, they understand the question, but they cannot communicate properly to Broca's. So Broca's say something which don't make any sense to the questions. Okay. Now, these are blood vessel disorder. We have to wait for those. Let's go fever versus heat stroke. This is some easy topics now. Fever versus heat stroke. When it comes to fever, remember, folks, it's a cytokine activation during inflammation. They have fever, right? Usually up to 104. So I would say 100.4 to 104. I repeat, we only consider fever when it's 100.4. Okay. You can't call 99 a fever, folks, okay? Don't do that. If some kids has 99.5, we could tell very soon they're going to get fever, but they don't have fever at that point. Does that make sense? All right. Febrile seizure. Usually when the fever touches 104, 105 on babies, infants, they get seizure. Now the key is it's an infection. Fever is caused by infection, which causes inflammation. Okay, so that's the idea. So we give medication to stop an antibiotic if needed. So that's a key. Now, when it comes to heat stroke, that's something different. It has nothing to do with the infection. It's basically brain problem. Yesterday we studied, right? Hypothalamus has nucleus that for cooling mechanism. Simply, your body has inability to excrete or release the heat. So your body is not able to keep up with the cooling mechanism. The temperature has to be more than 104. Okay, that's a heat stroke. And CNS dysfunction, people get rhabdomyolysis, confusion, acute kidney injury, all those things, folks, okay? So there's no infection. It's basically your body is not keeping up with it. So which means they must do some activities where that increases the heat. You can't just stay inside the room in the house and get a heat stroke. Does that make sense, folks? So a good example is like, you have to be exposed to a heat. So your body is absorbing all the heat, but they are not releasing, right? Now I'll give you a quick example. There was sometime I get military students taking my program because there's a university in South Carolina. These are military, Army and they are doctors, but then they also have to take the same board exam before they practice it, right? So they were telling, I had some student who actually was deployed to Afghanistan when the war happened. So they were telling me when they go on the war field, so every time a troop goes, the troop has about 8 to 10 people, and they always put one medical professional or paramedic in that group to take care of it, right? So one of the most common complications they feel when they go in that temperature, they say that Afghanistan temperature is like 110 degree on a summer day, right? 110 degree, and they have layers, 3 or 4 layers, the dress they wear with the whole suit and stuff. The interior temperature is 130 to 146. That's a temperature they feel on the skin. Okay. Now we sit in the AC room and tell them they are not doing the right thing, right? So, but the idea is 130 to 146, folks, it's actually almost like you are staying in sauna room, right? Like even in sauna, staying there for half an hour is difficult, isn't it, folks? They stay in that temperature, and they said one of the most common problem they get, the soldiers started getting confusion because of heat stroke. They cannot carry so much water. They cannot do any of those things, right? So that's what the heat stroke is, folks, when the temperature increases. So that's the idea here. So the treatment, of course, rehydration and electrolytes correction and stuff, and then rapid external cooling mechanism, folks, okay? That's a heat stroke. So that's the difference between fever and heat stroke. Is everybody clear? All right. Next, seizure. Now, we could use this graph. Same thing I used to draw, but now they have it in the first aid. First definition of seizure: abnormal electrical activity of the brain. That's all it is. Same thing as a cardiac arrhythmia, abnormal electrical activity of the heart, but this is the brain, right? Your brain has action potential, folks. Whenever you have an abnormal action potential, that creates a seizure. Now, we create the seizure into 2, partial and generalized. What does that mean? Partial mean one part of the brain has abnormal electrical activity. Generalized mean the entire brain has abnormal electrical activity. Is that clear, folks? Now, when we say partial, there's the one part of the brain. That part could be responsible for your hand or could be responsible for your leg. So it has to be one part of your body that reacting. Does that make sense, folks? So that's partial seizure. Now we divide the partial seizure into 2: simple partial, complex partial. That's all it is. Now, partial seizure, when you see a patient on the floor and they're having a seizure, you could see only some part of the body is shaking, not the entire body, because it's partial. Is everybody clear, folks? Okay. Now, the difference between simple and complex is simple. Complex, loss of consciousness. They lost the consciousness. Here, no loss of consciousness. That means they are still awake. Is everybody clear, folks? So only the level of consciousness differentiates simple from complex. That's easy, okay? Are we good with partial? All right, now let's take a look at generalized. Now, when it comes to generalized, the whole brain is activated abnormally. So that means your whole body is going to react. Let's start with first one, tonic-clonic, grand mal seizure, folks, okay? When you see the word tonic-clonic, alternating between stiffening and movement, no relax in between. You should write it down. These people are not relaxing at all, okay? It's a tonic and clonic. It's like stiff, and then they are moving. Stiff, they are moving. So there's no relaxation in there, folks, okay? It's such a breakdown of muscles. I don't know if you ever get to hold an adult having tonic-clonic seizure. To hold one adult, you need about 8 to 10 people if you want to hold them on the floor, folks. It's not easy. When they have seizure, that is the maximum strength of the muscle that happening out of your consciousness. Unbelievable. You can't hold it, folks. I had a hard time holding a 7-year-old kid once. I was like almost on top of him, still couldn't control it. If my weight couldn't control it also. So it's that hard to hold a person, okay? That's tonic-clonic, folks, okay? Now, when you look at the next one, just a tonic, right? We call it stiffening. They scroll on the floor like a snake. They're just stiff. That's it. They're not shaking, nothing. We get this through tetanus toxin and stuff sometimes, folks, okay? Those things can give. When you look at them, they're like a fully spasmodic. The whole body is stiff. That's it. Then you have a myoclonic. Quick and repetitive jerks, right? You have a contraction and relaxation, contraction and relaxation. So that's how it is, contracting and relaxing. That's myoclonic. Absent seizure is a board's favorite. We call it petit mal, especially in the kids. Why do we call it absent? They look at some object, they don't blink their eye. That's the idea, folks. They won't blink it for like a couple of minutes. Blank stare, no post-ictal confusion. They just keep looking at it, folks, okay? That's petit mal seizure. Then we have the last one, almost impossible to see, but theoretically possible. We call it atonic seizure. Basically, they just drop on the floor and people confuse with fainting, but they didn't faint. They actually had a seizure, okay? That's the idea. So these are all different type of generalized seizure. One of the question I came across, they gave a scenario of a partial seizure. They asked, what could be the complication? That means when a patient has partial seizure, if you don't do anything, they will develop into generalized. That's a complication. Partial becoming generalized seizure, folks. Okay, that's the idea. So I was in one of the Asian country, so a couple of years ago. I saw on the street, somebody had a seizure. Okay, they were falling on the... I see people running to that guy and giving a metal in their hand to hold it. Okay, they were giving a metal in their hand to hold it. I was mind blown why they were doing, and why do you think they did that? After giving the metal, the seizure comes down. Because metal is one of the best electrical conductor. And when they give the metal, the whole electrical activity is attracted towards that metal. And the body slows down. Now, the people who did it had no idea why they do that. It's a ritual in the country. When they see somebody with seizure, go give them. They even give the keys, like a whole bunch of keys to hold it. Some metal, they need to hold it. So they don't know why they are doing it, but they know that's why you need to do it at that point. It's amazing, isn't it, folks? They don't know the mechanism behind it, but they do that, right? So that's unbelievable. So the whole idea is by doing that, you slow down the muscle breakdown. So you're not going to have too much muscle breakdown. You're almost protecting the kidney and stuff, folks. That's unbelievable, right? So I started talking there. That's how I found that. And the same thing in my country also they do. When you have a ear infection, they take the garlic, they burn it, and they put it in the ear. Have you heard that thing? That thing stings the whole room if you do that. They put that in the ear, they keep it. It looks so retarded, but they keep it there. And in 2 days, they feel better. And they have a sore throat. They give the garlic to chew and eat, and the sore throat goes away. Why? I didn't know. I had to research all this thing. One of the most common chemical for augmentin comes from garlic. Your antibiotic augmentin, right, amoxicillin, is taken from garlic. So what they're doing by keeping the garlic, they're actually keeping the augmentin there, folks. Okay, that's the idea. You see how the chemical values, right? So that's what they say. Even if you have a little sore throat, you chew a garlic. Don't ask me if I did last night. Hell no, I would not do that. I'd rather take augmentin than eating the garlic. But the garlic, it's actually cures it, folks. Okay, those are the interesting parts. Same thing for the metal rod that attracts the electrical activity. All right, so that's that. Now let's take a look. What have we talked about? It's in here. You could read. I'm going to spend time on the side. Now, definition of epilepsy. Keep in mind, when somebody had first seizure, let's say this is their first seizure in their life, no diagnosis can be made. No diagnosis of seizure can be made. because we cannot just make somebody with a seizure disorder because they just had one. Is that clear, folks? Number two, when the seizure happens due to fever, that's called febrile seizure. Okay, that is not part of seizure. What is febrile seizure? Body temperature increased and that started to shake. That is not considered seizure, folks. Okay. Epilepsy means they had a recurrent seizure, folks. Okay, look at that. Febrile seizures are not epilepsy. Okay, so when people have multiple seizure attacks, then we call that, folks. Status epilepticus means when somebody has a seizure for more than 5 minutes continuously. Okay, that's the idea. Why seizure is bad for a long time? It breaks down the muscles so badly, and people will have kidney failure, all these things because of the myoglobin, folks. Okay, now the causes. If you see children, it's always genetic and infection. Adults 18 to 65, tumor, trauma, infection. But overall, if you see, fluid and electrolytes seems to be the reason for most of the adult seizure, folks. Whenever the fluid and electrolytes imbalance happen, this can start, folks. Okay. Now you could ask me, how about infection? Infection causes fluid and electrolytes imbalance. Is that clear, folks? That's the idea. Okay. That's the key. That's one of the reasons doctors say that when people have infection, once in a while to drink Gatorade is basically, we want you to have enough fluid and electrolytes in your body so nothing goes wrong. Elderly people are very sensitive for fluid, folks. Okay. So that's the key here. Now, the last thing, you don't need for step one, but I will mention, when somebody has a first seizure, you never do EEG. EEG cannot be done on the first seizure. It's a protocol in the United States. We cannot do it on the first episode. We could only do EEG when they have for the second time. Okay, that's a protocol. It's the neurologist made that rule in the United States. See, every internal medicine organ system have their own association. They have their own protocol, folks. So when you become a doctor and you work in the hospital, you follow that protocol. You have to follow that protocol. You cannot change it. Even if you want to do that, you have to. I mean, if you are an attending, you could change around. See, that's a benefit of being an attending. You could do whatever. But then when something goes wrong, the association won't back you up. Is that clear, folks? All right. So that's a protocol. We don't do EEG on the first seizure. Okay. So that's that. Any question in seizure?
Dr. Roy, if someone has a seizure and something white comes out of their mouth, is that a seizure or what?
It is a type of seizure. It's basically saliva making into a foam, folks. That's the most of the time. Yeah, it's a seizure. Yeah. That's basically they're gargling in the throat because they are not able to breathe properly when they have a seizure. And when you see a seizure patient, what do you do first, folks? You always turn the face to the side. Why do we do that? Because sometimes the tongue has become paralysis, it falls back and it can block the breathing tube. Especially kids, so we always turn it to the side. For adults, not even adults, anybody, when they have a seizure, they have a mouth, there's a special guard in the ER, we keep it, we have to put it inside their mouth. Sometimes the seizure can cut their tongue into two. That is the worst thing can happen for it, folks. Okay. For kids, sometimes they actually, if you can't find it, some doctors are so good that they put their hand in their mouth, actually. They take a cut in their hand, but they don't want the kid to bite their own tongue because then they cannot talk forever. Does that make sense? That's very important, folks. Okay. All right. So that's seizure. Let's go. Headache. Now, when it comes to headache, there's a three main type of headache: cluster headache, migraine, and tension headache. You have a high chance to get a question on cluster and migraine, but let's see. Cluster headache is always unilateral. And it happens at the same time of the day every time, same time of the day every time. What does that mean? If somebody gets cluster headaches in the evenings, that person tend to get the headache only in the evenings most of the time, okay? So it has a patterning for that. Number two, it gives you that really bad periorbital pain, or what we call retroorbital pain. They feel like behind the eyeball, something is stabbing, okay? And they have a tears, lacrimation, rhinorrhea, runny nose, all these things. See, this is the only headache that gives you tears and runny nose, folks, okay? So it's kind of easy to pick up on the exam. It can even present with Horner syndrome. Now, when it comes to cluster headache, the first treatment you go for is 100% oxygen. Giving 100% oxygen helps. Then you could go for sumatriptan. You could also go prophylaxis with verapamil, calcium channel blocker. So let's say patient comes to me and I give sumatriptan, and then patient comes back next day with some sort of really bad pain in the body. Where could that be? Type it up. So I gave sumatriptan. Patient comes next day with a really bad pain that comes and goes. Where would that be? Let's see how many people can connect this. What is the sumatriptan side effect? We know that. I mentioned 2 times so far. It gives you Prinzmetal angina, folks. Remember that? Ooh. So they come with the chest pain. Prinzmetal angina, it's the one that comes and goes, right? Write it down. It's checked on the exam frequently. One of the side effects that sumatriptan is to get Prinzmetal angina. Stomach pain. That's Prinzmetal angina gives you chest pain. And what's that EKG finding for Prinzmetal angina? Transient ST elevation, right? Temporary. Okay, very good. Transient ST elevation. All right. So that's cluster headache. Now, let's take a look at migraine. Migraine is also unilateral. It can stay up to 72 hours. That's 3 days. Pulsating pain with nausea, photophobia and phonophobia. They get irritated with sound and lights and stuff. May have aura. Aura is basically unusual sensation right before the headache. Okay, right before the headache. Some people see things, some people smell things. I have a migraine for the past 18 years, folks, right? My smell is a burning leather smell. I feel like something is burning, and the minute I smell burning something, I go crazy because I think I'm going to get the migraine, right? Because of that, it's paranoid actually. Because the minute I get the smell, I take 4 ibuprofen, 800 milligrams, which is too much. But sometimes it turned out to be somebody was burning something on the down the street, but I don't care. I take my ibuprofen, right? That's important. Due to irritation of CN5, meninges, and blood vessel, they relieve this vasoactive neuropeptides. Just to remember, one of the mechanisms they found for migraine is vasodilation. Vasodilation causes migraine headache, folks. Okay, vasodilation causes migraine headache. Now, how many people seen in Walgreens and CVS Excedrin medication? Excedrin is like my best friend. I carry it everywhere. It's why Excedrin works better than ibuprofen. Excedrin has ibuprofen or similar aspirin, acetaminophen, but the most important thing is caffeine. That pill has a really good amount of caffeine, which I love it usually, no matter what. But then caffeine causes vasoconstriction, so that helps. That's why. Okay, so that's a smart idea to come up with that pill, folks, because when you take that pill, 10 to 20 minutes, your headache is gone. That's it. Even if you have a tension headache, you could try next time. And the headache is gone, 20 minutes, that's it. And it's a kind of, once you use the Excedrin, you cannot use anything else because you see the headache going away. So almost you would say that you kind of get used to Excedrin, right? So you take it, it goes away. It's because it causes vasoconstriction. If you are somewhere you don't have Excedrin, what I used to do is I would take ibuprofen, then I will do a black coffee and drink. But then the dosage you get in the pill is completely different than when you drink the coffee. Of course, the same thing you have it in a good dark coffee from Starbucks, black coffee gives you the same, right? So the caffeine gives you vasoconstriction and bronchodilation. You should always know that. Why did I mention that? If you are somewhere, you are place somebody has asthma, if you don't have access, you could actually make a black coffee and give it to them. It will make it better because it gives you bronchodilation. Is that clear, folks? So that's important, folks. Okay. So that's that. Now, treatment, same thing. Look at that, pretty much everything. And when it comes to migraine, it's all about lifestyle changes, folks. Okay. People knows what causes migraine, right? Some people, if they don't get enough sleep, they get headache. Some people exercise gives you, some people different diet, right? So for me, if I don't sleep, I cannot really eat dark chocolate. It gives me headache, and I cannot drink red wine too much, maximum 1 glass. If not, I get that. So different people have different. So you have to identify and rule out. These are medications. You could do that also as a prophylaxis, folks. Okay. So that's your migraine. Is everybody clear?
Can you explain how the mechanism of vasodilation causing the pain?
See, it is not the only mechanism, but they are releasing this material, but the vasodilation also give you the sensation of the brain to give you that feeling of headache. So we don't know what exactly that vasodilation is doing, but we know when the vasodilation happens in the brain, you started feeling that pain. So that means there must be some diffusion issue with the brain tissue, which beyond us. Maybe neurologists can, to bringing that. Now they introduced a new fellowship. After you become a neurologist, you could do actually 2 years subspecialty just to become headache specialist. So that tells you it's a whole world beyond it's there that people do that, okay? So that's migraine. Tension headache, yeah.
Is there a hereditary component to like cluster and migraine?
Migraine, there are articles that I read, but nothing has proven so far. Yeah. Now, tension headache. That's a regular headache people get, bilateral. It's the best way to explain. You feel like somebody's squeezing like a band-like effect on the head, folks. Okay. Now, this is your headache that when you don't eat, the headache comes after hangover, all these headaches, regular headaches, folks. Okay. Now, it's a steady band-like pain, no photophobia, no phonophobia. A lot of the people I see, they misunderstand. They have a regular headache, but they think they have migraine. They don't. Okay. Some people think it's fancy to say they have migraine. No, you don't want to do that because that's the worst thing anybody can get that, folks. It's like you go somewhere, you get that headache, the whole day is done after that. And not only your day, your family's day is done too, right? That it's a nasty headache to people to have it, folks. Okay. And so that this one, treatment, analgesic, NSAID, and acetaminophen and everything. Same thing with prophylaxis. Now, at the bottom line, it doesn't matter what type of headache. None of the headache should be staying for more than 72 hours. If you develop a headache and it's there for more than 72 hours, you get to the ER as soon as possible. If you have a headache for more than 72 hours, that means there's some big thing happening inside the brain. Either you are bleeding or something is not right. Okay. So that 72 hours is the key, folks. Okay. So that's the idea. Even migraine, don't stay for 36 hours. If you have it that day, when you go to sleep and you wake up, you are good. Very rarely in my life that I wake up and still has not gone. That's even worse because now you wake up, you have a headache, right? So, but still, never go for more than 48 hours. Impossible. But 72 and more, 9 out of 10 patients who has the headache. So that's why they want you to go to ER right away, do a scanning. Now, that's that. So that also gives you another hint. If you want to go to the ER and they want you to take you in faster, you could simply tell I had a headache for more than 3 days, 4 days. They will take you right away inside, folks. You know, in ER, headache for more than 72 hours and a chest pain, no matter what, they will take you in. But then when they take you in, you could tell the pain is not here. It's a little bit lower. It's abdominal. pain, because you don't know you pretend like you're dumb, you don't know what you're talking about. So they will take you in, right? That's the best way to do it. So that's the different type of headache. Any questions so far? All right. Next, trigeminal neuralgia. This is important. Trigeminal neuralgia, think like a shingles, but has nothing to do with the shingles, but the pain is the same dermatome for the face. It happens in the face, which produces repetitive unilateral shooting shock-like pain. People say it's like somebody's cutting with a knife, layer by layer. That's how it hurts. It's very bad pain, folks. Triggered by chewing, talking, touching. There are people, they say to take one bite of a food, it takes 6 hours sometimes, because the minute they move the lips, the pain comes back. You see, we are blessed, right? We don't appreciate how healthy we are. Those things, okay? And that's trigeminal neuralgia. Only thing you want to remember, the one and only treatment with the medication is carbamazepine, which also give you gingival hyperplasia. That's all you want to remember that, folks, okay? And now they have, of course, more surgical treatment for those things, but that's trigeminal neuralgia. That's your headache. All right, let's go. Let's go to ear. Now, when it comes to ear, again, we're going to touch base the very basic. We're not going to go into ENT, simple things. We have external ear, middle ear, internal ear. So we divide the ear into 3, folks, okay? That's how we divide. Now, if I were to draw that, just to keep it simple, so let's say we divide it into 3. External, middle, internal. Middle ear is the one that has a tube that connects with the pharynx. Is everybody clear, folks? We call that our auditory tube or eustachian tube, folks. Okay, that's a tube that connects. Let's understand some little diseases that. Okay, now that's a ear lobe. Okay, so you could get different issues in different ear, but let's do physiology first. Internal ear is the most important of a human, that you don't mess around with it, because the organ of Corti is inside. Is that clear, folks? Middle ear, internal ear is the one that has organ of Corti, and you have to protect that no matter what. Now, if you see here, outer ear, right? Its visible portion, ear pinna, includes auditory canal and tympanic membrane. Everything transfers sound waves via vibration of tympanic membrane. Okay, that's that. Middle ear is air-filled space with 3 bones. We have that MIS, we call MIS, that's malleus incusstatus. And these are the bones that amplify the sound from tympanic membrane to inner ear. Inner ear is where all the final thing happens, contains basilar membrane that vibrates secondary to sound waves. And it's also auditory nerve signal curve goes to brainstem and everything, folks, okay? Organ of Corti. And there are 2 things that you want to kind of remember. There's a low frequency heard at the apex, high frequency heard best at the base. What does low frequency mean? Low frequency sound and high frequency sound. Some people see they have a problem. Some people cannot hear when you talk with the high frequency, but they hear when they talk with the low frequency, right? Older people have this problem and they don't accept that, but they said, don't scream, talk slow, right? The problem is it's not screaming. If you scream, they cannot hear it. Okay, so those are the different types. So now, let's talk about one of the most common infection that you will get is called otitis media. Otitis media is like a candy for kids, folks. It's very common, right? They get that infection. What happens? Now, you should always know how to connect these things, folks. When you get throat infection, okay, sore throat, it doesn't have to be strep throat, any upper respiratory infection, nasal congestion, any of those. Nobody develop ear infection as the first one. They develop upper respiratory infection and then it spreads into the ear. Is everybody clear, folks? Why? Because the organism will travel from the upper respiratory, okay? It travels all the way here to the middle ear. That's why, like today, so you see that I feel like almost third day when's my congestion started, right? Now, I always keep an eye on it. Do I feel a little weird in my ear? If I see that my ear is getting full, then it tells that it's spreading to the ear. Does that make sense, folks? Once it goes to the ear, what happened? This tube collapses or it gets blocked with this material. So eustachian tube is blocked. Now the infection is in the middle ear. They are releasing more fluid and stuff. Can they come down? No, they cannot come down. What's going to happen? They're going to end up pushing the tympanic membrane. Is everybody clear, folks? Now I'm going to put an otoscope in the ear. I'm going to see a bulging tympanic membrane. Is that clear, folks? The minute I see a bulging tympanic membrane, we know it's otitis media. That's how you diagnose, isn't it, folks? When you go to clinical rotation, I've seen students get lost. They don't know what they're looking inside the ear. When you look, check for tympanic membrane, you will see it's a very shiny and bulging. The minute it's bulged, they have infection. Is everybody clear, folks? That's the idea, okay? Now, how can you prevent that? So what do you think I should do today that I won't get ear infection? I have to do something to keep this tube open. Does that make sense, folks? Two things I could do. I could take a nasal decongestion, which is a chemical, or I could do a steam to my face. You guys heard about that steam? So steam, or simply go sit in a sauna for half an hour. That's the best, right? What does it do? When you do a steam, they open up this tube, everything started draining. Once it drains, you have no problem in the ear. Is everybody clear, folks? But why I shouldn't, so that's what I do. The good thing, if I go to sauna, I could also give it to a few more people who sits in there, right? So I shouldn't, okay? So because it's a close contact, isn't it? Now I could also fight with them and say, hey, it's 130 degrees. This organism shouldn't be surviving in that heat. But then there's a heat labile organism who can survive that heat, okay? So I shouldn't, okay? So that's the idea. So that's the middle ear infection. So otitis media. Is everybody clear, folks? All right. Now, we talked about otitis media. Now, sometimes people ignore otitis media because not all of the ear infection gives you symptom. There is a bone right here behind. What do we call that area? That's your mastoid bone, right? I want you to feel it, everybody. It's right behind here, right? The mastoid bone. That's a very important bone. If you don't take care of the middle ear infection, the infection can spread to the mastoid bone. Mastoid bone can become full of abscess. If your mastoid become full of abscess, technically I am saying you have a brain abscess. Because why? That's a part of your brain. Is that clear, folks? All right. Look at this. Infection of the mastoid process of the temporal bone, complication of acute otitis media. Look at that. May lead to brain abscess. That's worse, folks, okay? So you don't want to do that. So that's otitis media and stuff. So organism is the same that causes upper respiratory infection. It's exactly same. Okay. There was some, I think, is it USMLE RX question? They asked what type of epithelium you have in eustachian tube. It's the same epithelium as your respiratory tract because they're all connected to one. What's the epithelium? Pseudostratified columnar epithelium. Remember that? See, whatever the epithelium is there, it's all connected to one, folks, okay? So that's that, folks. The last one here, otitis externa. That's a little bit more severe. That's external ear. If you are reading a question, I'm looking for that one word. Let's see here. Where is it? Why they don't have that here? Okay. Oh, it is. Highlight this word first. If they show or if they tell that there's a granulation tissue is on external ear canal, it is Pseudomonas until proven otherwise, folks. That's the only thing you need to know for step 1. Okay. So we call this otitis externa, inflammation of the external auditory canal, usually associated with swimmer's ears and stuff, and presents with otalgia that worsen with ear manipulation, right? But look at this, malignant otitis externa. There's a high chance you could get this on the exam. It's an invasive infection causing osteomyelitis, complication of otitis externa, folks, okay? But if you read a question, the question says granulation tissue is found, folks. The minute they see granulation tissue, this is the problem, okay? That's a Pseudomonas and you need to give antibiotic for that. All right. Yeah. So that's that. Now we're going to go into this one. Give me a second, folks.